Can you hear me? Yeah? Okay. My name is Elizabeth McCarthy and I'm in the healthcare team in Deloitte's consulting practice in Dublin. I'm going to speak to you about some experiences and lessons learned that Deloitte have had globally in programmes of e-health implementation, so across individual hospitals or across networks of hospitals. So I have 6 kind of key learnings or priorities that need to be considered to ensure the success, or at least do the best you can to ensure success of an e-health transformation programme. We know that there is a large programme of transformation planned for Ireland. The HSE published the Knowledge and Information Plan in May 2015, which has very ambitious plans. As we know, they are essential. Reform of the healthcare service in Ireland is badly needed. But there's, and we know that the benefits are huge. So in terms of increasing patient safety, in terms of improving the efficiency of hospitals, supporting clinical decision making, providing patients with an opportunity to help themselves to get better through remote monitoring and wearables and preventative care. All of that will deliver huge benefits to the Irish Health Service, but there are some things that seem quite obvious but do seem to be missed regularly in terms of overall programme implementation. So the first one is that IT implementations are in healthcare more than that. They need to be considered as business projects and change projects. If you go into a large e-health implementation programme like you do another IT programme, it is unlikely to be adopted. So even if you manage to implement your systems, if you walk away without having secured engagement from users, it's pointless. So first of all, you need to consider the wider strategy. So for example, here in Ireland we have, obviously the strategy is to improve the standard of care for patients and to improve efficiencies in hospitals, but that needs to be very closely linked to any e-health programme. There needs to be a robust business case, and that is essential, especially if you consider, for example, the e-health, EHR, the national EHR that's planned for Ireland. That's a decade-long programme, and there will be a need to show value incrementally along the stages over that decade. Otherwise, buy-in will be lost for that programme. In terms of ensuring buy-in, stakeholder engagement is crucial. So clinicians need to be wholeheartedly engaged at the very start of a programme. Firstly, because we need their expertise. We need to make sure that systems are designed in a way that will actually meet the needs of the people that will use them. But we also need that buy-in to ensure the systems are actually used when they are put in place. We need dedicated project management offices and project managers. Too often you can see that you have clinicians who are double jobbing, trying to support the implementation of a project while also trying to deliver work. And even if they have the capacity, there needs to be people who are solely dedicated on putting in place projects. Obviously you need advocates and you need champions who are clinicians. That's key, but you need a dedicated team whose sole job is to make sure that that implementation is successful. In terms of networks of hospitals, or you need to ensure that operations are standardised as part of the overall process of implementing a programme of change through e-health. If you don't have standardised operations, you won't be able to reap the full benefit of the system that's put in place. You won't be able to reap the efficiencies that you could, or the opportunities for collaboration that you could. Another thing to be very aware of is that implementation on a phased basis is really, really crucial. If you're working in a very pressurised healthcare environment, you need to not have the extra burden of your day job and trying to absorb all of this information all in one big bang. There needs to be a phased implementation. That is crucial to ensure that there is acceptance and buy-in at the beginning. And that ties into training and change management. So there needs to be clear communication. There needs to be training. The training needs to be user-centric. It needs to be completely tailored to a particular person and needs to be very cognizant of the needs of specific people and not just a broad, wide training program that doesn't necessarily hit all the key points for everybody. So that's I think the most important point, is that IT is an enabler for change, but overall IT implementation, EHR for example, that implementation program needs to be considered as a change program, a business project, not an IT project. So the next thing is we need to manage expectations on going paperless. So you have a digital hospital. An entirely digital hospital has all patient records are digitized, but also all the information that is arriving into the hospital is through digital channels. That is an extremely difficult thing to achieve. It's quite unrealistic, really. According to HIMSS, in the US, less than 5% of hospitals are actually fully digital hospitals. So expectations need to be managed. There are different approaches that you can take. You can take a paper-light approach, where you might decide in a hospital to digitize all the records of patients who are present and keep hard copies of past patients, and only for new patients arriving or old patients whose records are being updated, then you digitize those. You might decide to digitize all the records you have, past or present, but still accept input into the hospital in a paper format. So you need to be realistic, but then there is obviously the caveat that when a system is first put in place, if people start using paper-based workarounds, they need to be addressed early before they become permanent and embedded. Access to information needs to be user-centric, so clinicians need to be involved in the design of a system from the outset. We need to make sure that in the design we are looking at interfaces that present information in a way that is most useful to each person who's using that system. And we need to be able to show to clinicians trends in terms of historical, the results of treatments of a particular patient, or correlations between data that will help, that will support decision making for a clinician. And we can't do that if clinicians are not involved in the design at the beginning. Cloud-based solutions obviously are pertinent everywhere. In healthcare, it's very crucial to consider at the start the different types of offerings. So you could have a private cloud, which is within an organisation's firewall, a public cloud, which has a cloud service provider managing it, or a hybrid of the two. You need to consider the type of service, whether it's software as a service, platform as a service, infrastructure as a service. All of those things need to be considered in terms of their privacy and security characteristics in healthcare, and particularly in terms of legislation and regulations that apply to healthcare. And not just the current ones, but you need to look down the line. For example, I think someone after me is talking about GDPR. But anyway, we need to consider, for example, that legislation which is coming into effect next May will have the requirement for explicit consent. You currently have an EHR program being implemented in Ireland in maternity hospitals. Explicit consent is something that needs to be considered in the design of that at this stage now, in advance. We need to be looking ahead at the things that are coming down the line. Analytics and reporting is something that really needs to be considered upfront. If you're designing a system not knowing what reports are going to be required at the end of it, you're fighting a losing battle. You need to engage with the people who will need to see, who know what they want to see when a system is in place. And it's such a simple thing to miss. You might just not store a particular piece of data in a format that's easily accessible for someone that would find that extremely useful if you just don't have a simple conversation with the right people at the start. So making sure that you discuss analytics at the start in the context of the overall infrastructure and design of a system is crucial. And also dashboards and reporting tools need to be somewhat flexible. You need to be able to give clinicians the opportunity to tailor slightly what they want. So for example, if you have a Tableau dashboard, you can easily pick and choose what different things you want to represent. And that has to be implemented, otherwise people will probably end up knowing or thinking that they can't access what they want and becoming disengaged from any analytics solution. So the efficiencies that you can get from making decisions based on data will be lost if you can't deliver exactly what people need at the start, because trying to secure engagement after a system has gone live and trying to work backwards is difficult. This is the last priority in terms of It's similar to analytics. The focus should be on designing at the beginning your strategy for mobility of patient data. So you need a strategy about end user devices at the start. You need to consider, do I want my paramedics to be able to access data on the move? Do I want my clinicians to be able to access data on their own personal devices? All of those decisions need to be made at the start when you're planning, so that the overall infrastructure that's put in place to support a system is tailored for that strategy that has been agreed up front. So overall, we have, I suppose, we're lagging behind other developed countries in terms of our maturity in e-health, but I think it's important to recognise that there are benefits in some way in that we can learn the lessons from other countries that have put in place programs, so we know the pitfalls. And these all seem like perfectly obvious things, but they are missed over and over. So it's important, I think, to look at the broader healthcare network and identify where we can avoid these sort of pitfalls. If anyone would like to talk to me some more, please do, just grab me afterwards. Yeah.